A 19-year-old runner walks into your clinic. Localized tibia pain. It's worse at night, but she tells you it disappears completely with a single aspirin. You look at the CT. There's massive cortical thickening. You think, stress fracture. But if you stop there, you've just missed a bone tumor in disguise. The Nidus Secret. Welcome back to AI Radiology Lectures by Dr. Mohamed Elmasry. Today, we are tackling the deadly twins, osteoid osteoma and stress fracture. On a standard X-ray, they can look identical. But the secret is in the CT. Look closely at this station. See that small lucent area with the central calcified dot? That is the nidus. A stress fracture will never show you this. Key aspects of cortical thickening and associated conditions. Osteoid osteoma, OO, often causes significant sclerosis, dense bone, and cortical thickening, hyperostosis, around a central, small, less than 1.5 centimeters, vascularized area known as the nidus. The tumor secretes high levels of prostaglandins, causing pain that is often worse at night and relieved by NSAIDs. Stress fracture causes cortical thickening as the body attempts to reinforce the bone due to repetitive stress, often characterized by a gray cortex sign, in early stages on X-ray. Diagnostic differentiation. While both can cause massive cortical thickening, a CT scan is typically the best imaging modality to identify the lytic nidus of an osteoid osteoma, which differentiates it from a stress fracture. Case overlap. A stress fracture can sometimes act as a trigger for the formation of a post-traumatic osteoid osteoma, making diagnosis challenging if the pain persists after immobilization. Treatment. While osteoid osteomas can sometimes be managed with long-term NSAIDs, symptomatic cases are often treated with minimally invasive CT-guided radiofrequency ablation. Common clinical similarities. Location. Both are common in the diaphyses of long bones, tibia, femur. Symptoms. Both can present with pain, swelling, and sometimes limping, in children. Imaging. Both can present with intense tracer uptake on bone scans and reactive edema on MRI. Clinical clues. It isn't just about the scan, it's about the story. If the pain is relieved by aspirin within 20 minutes, your suspicion for osteoid osteoma should skyrocket. Getting this wrong means the difference between months of unnecessary rest and a targeted radiofrequency ablation that cures the pain instantly. Let's look at how to report these findings so your orthopedic team knows exactly what to do next.